Montana is talking here. This is Montana Talks with Aaron Flint.
All right, let's jump right into it here with Congressman Greg Gianforte joining us live on Montana Talks. Congressman, thanks for being with us this morning.
Aaron, good to be with you.
Well, first off, I know we catch up with you regularly from time to time through your role as our member of Congress here, lone member of the House from Montana. What we're talking about this morning was something that we didn't necessarily see planned here initially, but with schools closed across Montana and all the uncertainty out there, what's your message for Montanans?
Well, I think the top line is we're going to get through this. I thought it was great, Aaron, that you highlighted some of the things that Stockman Bank, the John Deere dealerships are doing. I'm spending my days talking to health officials, small business owners, ranchers. We're in unfamiliar territory, but I am confident that this will pass and we're going to get through it. If people follow the precautions that the CDC has laid out, we can limit the spread of this virus. We're getting some preliminary data out of some other countries that the mortality rate is not as high as it might have initially been estimated, but we're in a very serious health crisis. We need to pull together. I think we're going to get through this, and we're going to get back on our feet and allow us to move forward.
So we spoke yesterday with Senator Daines about some of the economic stimulus plans that are being discussed, ideas that are being thrown around on Capitol Hill. What's your take? What do you think we need to do to help our economy during this time?
Well, we've done some stuff already. I mean, in phase one, we passed an $8 billion funding package that makes more diagnostic tests more broadly available, provides the resources to the CDC so that we can get a vaccine so that we're not in this situation again in the future. Also, we've taken some really dramatic steps in breaking down the barriers in telehealth. That's going to help rural Montana in all cases. So that's all good. Phase two just passed yesterday. Was a second package that waives all the testing fees for the COVID-19, provides sick leave for workers and families that are affected. Also, emergency funding for unemployment insurance so we can keep those coffers full as people have to stay home to care for loved ones or to watch kids. Here's, I think, the critical thing. As we look at additional economic stimulus, we have to keep two things in mind. One, this crisis is going to pass. We don't know exactly how long it's going to last, but when we come out of it, we've got to make sure first that families and individuals can stay on their feet. This isn't a challenge that they selected. Government's got to step in and help there. And then secondly, for these businesses that are shut, whether restaurants, bars, or tourism-based businesses, so many people are affected. I've been talking to them. Many layoffs have occurred. We've got to make sure not only we take care of the individuals and the families, we've got to make sure through these economic stimulus that these businesses, once the virus passes, can open their doors back up and we get back to some form of normalcy.
I know some of the ideas being thrown around. We're hearing, could there be $1,000 checks sent to individuals all over the country, other types of economic stimulus measures. But I know one thing you've been working on is regards to our taxes. In fact, less than a month away, we've got our April 15th tax filing deadline. I know some have called on the Treasury Department to hold off on that deadline. It looks like Mnuchin might be resisting an all-out, deadline delay. But what are some other measures that you're specifically calling for right now with regard to taxes?
Well, we do have some good news on taxes. I did lobby with Secretary Mnuchin to delay tax payments for individuals and small business, and they made that official this week. So individuals can now defer up to $1 million in federal tax payments. So basically, the bill's not going to come on April 15th. The deadline's been pushed out till July. The same is true for corporations, up to $10 million, pushed out 90 days. Again, what this does is it keeps more cash in the economy at a time when we desperately need it. So that was very good progress, and that was announced by the administration this week. I was glad that they responded to my request and took that action.
What's the biggest take? You mentioned reaching out to health providers all across Montana, reaching out with phone calls, conference calls. What's the biggest takeaway you're getting from our health providers across the state?
Well, they don't know how big this crisis is going to be. I mean, we have to face the fact that we're in uncharted territories. I had a call earlier this week with about 50 presidents of hospitals, senior care centers, and they, the issues they raise, they don't have an infinite supply of personal protection equipment, face masks, gowns, these sorts of things. They're concerned. If there's a big outbreak, they're limited in the number of ventilators they have. So we've taken some steps there. The Montana National Guard has a medical battalion that has respirators that are available to go to hotspots as needed, and the DoD has about 2,000 of these respirators. That if people have respiratory problems and need ventilators, we can mobilize some of this equipment from various places around the country. Now, none of the hospital administrators I spoke with said we're out of supplies. They're just concerned of running out if there's a larger outbreak. At this point, we've had what are we up to? 11 cases in the state here. 10 of them in the state, one back in Maryland. So if we take the precautions that the CDC is recommending, we can contain further outbreak and get our arms around this. And again, this will pass.
Ken, good to hear from you. Did you have a question or comment for Congressman Gianforte this morning?
Yes. Good morning, both Aaron and Greg. Instead of, a stimulus package and taxes, instead of, giving people, just handouts and money, how about abolishing overtime tax? It's your middle income people and your lower income, they rely on that overtime for a lot of times to make ends meet or just icing on a cake.
And then oftentimes you get hit with even higher penalties. It's like the more you work, then now you bumped up your tax bracket and you get hit even harder.
Exactly. And the other thing is maybe tax athletes and actors and entertainers at 80% and give that money out as bonuses to your first responders, your teachers, your enlisted military. Just a thought.
All right, Ken, great to hear for your call. Congressman Gianforte, your thoughts?
Yeah, I think we're getting all kinds of ideas coming in. I think they're all valid. We ought to put them in the pot and see what is the right mix. I think the critical thing as we look at stimulus is I'm mostly concerned about individual working folks that don't have a paycheck. Those are the ones we want them to be able to stay home, take care of their family, take care of their kids, and get them back on their feet. So the lens I'm looking at this through is what programs can we put in place first to take care of individual working families that are living paycheck to paycheck to make sure they can get through this period. And then secondly, for the small businesses, farmers and ranchers all over the state, what do we need to do from a stimulus perspective to make sure that they're actually solvent when this virus crisis is over? Because we've had to shut down restaurants to limit interaction between folks. We want those restaurants to be there again after this crisis passed. So that's the lens I'm using. I think those are the principles we have to use. How do we get money to individuals that don't have a paycheck and make sure that businesses are solvent so that we don't actually permanently shut down our economy? It's just a temporary shutdown.
And that's a good point, because some broad-based high dollar figure will cost our country more money at a time where we already have a huge national debt. Whereas if we target those measures at those who truly need it, it'll be a lower hit on our national debt as well. Congressman Greg Gianforte with us here. Next up, let's see Dan in Kalispell. Are you there, Dan?
I am.
Yeah. What's your thoughts, Dan? Good morning.
And good morning. I've been concerned about the preventive lifestyle that we can live to cut down on the chance of getting the virus. You had an earlier call that mentioned food. I'm going to want to discuss air. First thing is we got to understand that this is the flu season. It always has been. And the flu season has low humidity. When we get rains, that changes. We also have a higher level of CO2 in our homes because our homes are closed up because it's cold. And so a couple of solutions to that is on humidity. Add humidity to your home. My grandmother, My mother, my great-grandmother's parents, always had a pan on the back of the stove that added humidity into the air during this time of year. I went through half a century and never had the flu. Number two is in the homes, they're closed up, so we come in, breathe up the oxygen, exhale CO2, and then the next day we do it again and again.
Well, then those germs are recirculating and things like that too. So that's why even I think probably getting outdoors can be a good thing as well, and getting a little bit of that fresh air, I think too. Well, Dan, thanks for your call. Sorry we are a little short on time this morning, but that also reminds me that the home construction business, it's a good time to support Montana businesses in that regard. You can get something like a whole home humidifier installed in your house, for example. Either way, Congressman Gianforte, you've been on the phone with all these healthcare providers across Montana. What are the main recommendations you are hearing from them?
Well, number one, if you have symptoms, don't go to the hospital. Go home and call your doctor. We want to minimize social interaction. Wash your hands. This virus is spread primarily through touch. It can linger on doorknobs. It can linger on other surfaces. And so, number one thing is wash your hands regularly. Avoid gatherings of larger people. And then, if you do have symptoms, don't go to the hospital, go home, and call your doctor.
Yep, that's what we've been hearing. And then they're integrating telehealth into all of that as well. I asked Senator Daines about this yesterday as well. I also spoke with Bill Coffey, the CEO of Stockman Bank, and John Ostlund, County Commissioner in Yellowstone County. And I think a lot of us feel that, yes, America will get through this and will come out stronger on the other end. It's just a question of when is the other end? When will we push through it? But what's your thoughts on the economy in particular and our ability to bounce back from this?
Well, we're taking a hard hit here. I'm thankful that we went into this February, one of the biggest positive job reports we've seen in a long time. So the economy was strong coming into this, and I'm an optimist. I'm a bull. I think we're going to recover. I think the people of Montana are resilient. We need to get through this. We're going to get through it together. Many, I would say, little things we could do individually. Bars and restaurants are shut down, but many of them are doing takeout. I would encourage people, order a meal. That's one way to keep a little cash flow going for these restaurants because they desperately need it at this time. There's other things we can do to pull together as a community, but we need to follow the CDC's recommendations here to minimize the spread. If we do that, our healthcare system will not be overloaded, and we can get back to life as normal as quickly as possible.
Yeah, well said on encouraging folks to support those restaurants with takeout, delivery, you name it. And then another thing I heard from Brad Griffin with the Montana Retail Association is, hey, buy gift cards right now. You can use those later. All right, Congressman Greg Gianforte with us here live. Lots of callers on the line. Chris in Billings, did you have a question or a comment?
Yeah, thanks for taking my call.
Yeah, what's on your mind?
Yeah, it's Congressman Gianforte. So I'm in the oil and gas industry here in Billings, and people would have to be pretty ignorant to not understand that the oil and gas has been severely damaged, primarily due to the pricing war between OPEC and Russia. Oil and gas industry nationwide accounts for 8% of our GDP, and 5.6% of that is in tight shale oil. I'm just curious if the federal government, once we get kind of through this corona thing and we kind of have working order, if we're looking at holding OPEC and Russia accountable for what I think is an egregious act against tight shale oil in the United States.
All right, great question. Let's throw that to Congressman Gianforte. Chris, thanks for your call. Greg, your thoughts?
Well, I agree with you, Chris. I think the president's action here, saying that he's going to purchase oil on the open market, put it in the strategic reserves, is going to help. But there's more we have to look at here. I think one of the president's number one priorities has been getting fair and reciprocal trade in place. And when people take aggressive actions like has been taken by Russia and Saudi Arabia to undermine our economic stability, we have to look at what's an appropriate reaction to that. I mean, I think that we are a stronger nation when we're exporting our energy around the world, and that is not, clearly Russia doesn't want to see that happen. So we need to have those discussions and figure out what appropriate actions are.
Yeah, and that's a storm that we're going to have to unfortunately weather, because those producers are so important right here in the Bakken, in our own backyard, and Russia is deliberately trying to put them out of business. That's clear. All right, let's see. Next caller up, Kyle in Kyla. Kyle, did you have a question or comment for Greg?
Yes, sir, I do. Mr. Gianforte, long supporter, first of all, I got to tell you. But I have a question that really concerns me. When the H1N1 virus was hitting the country, over 59 million people were infected. Why? And I realize that COVID-19 is more contagious than H1N1 was. But why this huge overreaction or reaction to a different kind of a flu? If 59 million people had COVID-19 right now, there would be panic throughout the entire world. I'm talking just in this country. People in this country had 59 million people caught H1N1.
So is this an overreaction then? Is this okay? Good question. I hate to cut it short, but we are short on time. Congressman Gianforte, I know you've been getting this question. Is this an overreaction?
Yeah, and thank you, Kyle. And it's a legitimate question. This is a very serious public health crisis. We have, there's about over 36 million cases of the common flu every year. We typically lose 20. This year, since October, we've lost 20,000 to about 50,000 people have lost their life in the United States to the common flu. So you compare these numbers of COVID-19 and you say, well, we're nowhere close to that. But the point that is important to understand, the mortality rate of this can be higher, particularly for people that are of greater age or have other infirmities. And the challenge, the reason these precautions are necessary is without them, we run the risk of massively overloading our medical system.